Hello, today we're going to briefly talk about blood pressure. Blood pressure is the force that your body exerts against the walls of your arteries as it circulates through your body. It's a vital part of how your heart and circulation work. Blood pressure normally goes up and down during the day and night. It's normal for it to rise during a time of exertion. If it's constantly high, even when you are resting, then you may need to do something about it. If left untreated, high blood pressure can lead to complications such as kidney damage, heart problems, problems with your sight, and also vascular dementia. You might be at risk for high blood pressure if you are over the age of 65, have someone in your family with high blood pressure, a smoker, drink too much alcohol, eat too much salt and not enough fruit and vegetables, and not exercising enough or are overweight. Around 1 in 10 women develop high blood pressure during pregnancy, and any concerns or worries should be discussed with your doctor, midwife or nurse. So what are the symptoms of high blood pressure? Well, most people don't know that they have high blood pressure because there are not obvious symptoms. That's why it's important to have your blood pressure checked. You can have your blood pressure checked by your GP, your practice nurse, and some other places such as pharmacies or some workplaces. If you're a healthy adult, aged 40 to 74, live in England and Wales, you will be invited to an NHS health check every 5 years. There are also various schemes which are running to enable people to monitor their blood pressure at home, and this can be automatically shared with their doctor or nurse. Blood pressure readings are given in 2 numbers, a systolic pressure, which is the pressure when your heart beats and pushes blood around your body, and the lower reading, or a diastolic pressure, which is the pressure when your heart is at rest in between beats. Digital monitors are widely available and can now be purchased very cheaply on the internet. We're now going to demonstrate how a manual blood pressure is obtained. My patient has come to see me to have his blood pressure taken, and I have obtained his consent. We feel and identify the brachial pulse. We place the blood pressure cuff onto the patient's arm. Feeling the brachial pulse, we then increase the blood pressure cuff until the pulse is absent. And at this point, we note the pressure. We let the blood pressure cuff down. We place our stethoscope over the brachial artery. We increase the pressure in the blood pressure cuff above the pressure that we noted previously at the point we lost the pulse. We should not be able to hear any pulse or heartbeat through the stethoscope at this point. We slowly release the pressure in the cuff, and as the pressure falls, we will start to hear the heartbeat, and the systolic pressure is recorded at the first sound of the heartbeat, and the diastolic pressure is recorded when the heartbeat is no longer heard. Normal blood pressure is usually considered to be between 90/60 and 120/80. For people over 80 years of age, the ideal blood pressure is under 150/90. Of course, if you are concerned about any of your blood pressure readings, then you should speak to your doctor or nurse, or I recommend the helpline of the British Heart Foundation. The British Heart Foundation website is excellent and full of useful information for you to consider.